Hey there. Did you know that your body can give you subtle signs when it's most fertile, but these clues aren't always obvious? Let's dive into what really happens during ovulation, break down its telltale signs, and give you easy ways to track them. Whether you're planning a family or just want to understand your cycle better, this info can help you get in sync with what your body is telling you. What is ovulation and why should you care? Ovulation isn't just a technical term in your biology textbook, it's a unique, monthly event happening right within your body. Ovulation occurs when an egg, matured in one of your ovaries, is released and heads down the fallopian tube. This moment, or phase, is key because it's when you're most fertile. For most, it happens around the middle of the menstrual cycle, roughly 2 weeks before the next period starts. Now, here's the thing, ovulation might come with signs like bloating or even breast tenderness, but not everyone notices these changes. In fact, about 10–20% of people feel mild ovulation pain, known as Mittelschmerz, a twinge or pop on either side of the lower abdomen. This mid-cycle cramp is one of the more direct hints that ovulation is happening. But there's a lot more to the story. Recognizing the common signs of ovulation. While ovulation can be subtle, learning to spot some of its signals can give you valuable insight into your cycle. Here's what to watch for. 1. Slight rise in basal body temperature, BBT. Basal body temperature is your body's resting temperature, taken as soon as you wake up. During ovulation, it tends to increase by about 1 degree Fahrenheit due to rising progesterone levels. Tracking your BBT daily might help you spot a pattern. Just remember, this temperature spike happens after ovulation, so while it's helpful for understanding your cycle, it's not a perfect prediction tool. 2. Changes in cervical mucus. Cervical mucus, which consists mostly of water, transforms during your fertile window. It becomes thinner, stretchy, and more egg-white in texture, a change driven by hormone shifts that help sperm travel to the egg. By checking the consistency of your cervical mucus, you can get a good sense of where you are in your cycle. 3. Breast tenderness and bloating. Some may notice breast tenderness or even slight bloating. While these can also be signs of premenstrual syndrome, if you're tracking them month to month, you might find that they peak around ovulation. 4. Ovulation pain, Mittelschmerz. As we mentioned, about 1 in 5 people experience a brief, one-sided abdominal cramp around ovulation. This happens as the follicle holding the egg ruptures, releasing fluid or even a bit of blood, which may cause a mild burning or a heavy feeling in the lower abdomen. 5. Subtle saliva changes. Believe it or not, dried saliva can show patterns, almost like tiny ferns, right before ovulation. Though this is a less reliable method, especially if you drink, eat, or brush your teeth right beforehand, it's a fascinating way your body can show signs of hormone changes. So, when exactly do you ovulate? For most people, ovulation takes place midway through the cycle, right after the follicular phase, about 2 weeks before the period begins. However, every body is different. You could ovulate sooner, later, or even multiple times within a cycle. Regularity varies, especially if you have an irregular cycle. The best guideline? Track your physical changes, like BBT, cervical mucus, and any cramping. Patterns will emerge over time, helping you get a sense of when you're most likely ovulating. Maximizing your fertile window. Your fertile window, the period when pregnancy is possible, isn't just about the day of ovulation. It stretches up to 4 days before ovulation and 1 day after, with the peak time being the day right before and the day of ovulation itself. During this fertile window, cervical mucus becomes most hospitable to sperm, keeping them alive for up to 5 days in ideal conditions. How can you track ovulation? A quick guide to options. Tracking ovulation isn't as daunting as it sounds. Here are a few simple ways to do it. Ovulation tests. These tests detect LH, luteinizing hormone, surges in your urine, indicating when ovulation is about to occur. Just like a pregnancy test, you'll urinate on a stick and wait for the result. BBT monitoring. Every morning before you even sit up, take your temperature and plot it on a chart or app. Over a few months, you'll notice a slight rise right after ovulation, helping you spot a pattern. Cervical mucus monitoring. Observe and record your cervical mucus daily. Around ovulation, it becomes stretchy, clear, and egg white-like. Apps and journals can help you keep track of these changes. Saliva tests. Though less accurate, some at-home saliva tests allow you to monitor for hormonal changes that create a fern pattern in dried saliva. These tests work best when used first thing in the morning and checked over a few cycles. What if ovulation is unpredictable? If you have irregular cycles, or you're not noticing clear signs of ovulation, don't stress. Many people ovulate irregularly, and it's possible to have a regular period without actually ovulating. Some may also experience anovulatory cycles, months when no ovulation occurs at all. Tracking methods like BBT and ovulation tests can still give you clues, but if you're not seeing patterns, consult a healthcare provider for further insight. Ovulation and fertility. When to see a specialist. Trying to conceive and unsure if you're ovulating? Many fertility factors exist beyond ovulation itself, from blocked fallopian tubes to hormone imbalances. Here are guidelines for when to consider seeing a specialist. If you're under 35 and haven't conceived after a year of trying, or if you're over 35 and it's been 6 months, talk to a healthcare provider. Some fertility issues can be resolved with non-invasive treatments. A specialist can help pinpoint any obstacles and develop a plan tailored to your needs. Tracking your cycle for more than fertility. Even if pregnancy isn't on your radar, monitoring your cycle can be useful. By understanding when you're ovulating, you can get a better sense of the fluctuations in your energy levels, mood, and even skin. Many find that tracking their cycle can help with planning, self-care, and stress management. Wrapping up, know your cycle, know yourself. Understanding ovulation isn't just for those hoping to conceive, it's for anyone wanting to know more about their own body. By recognizing the signs, you can gain a clearer sense of how your cycle impacts you, from energy highs to those low, bloated days. Whether you're tracking your cycle on paper, using an app, or simply paying closer attention to your body's cues, ovulation knowledge is a powerful tool for self-awareness and health. Thanks for joining us on this journey through the signs and mysteries of ovulation. Be sure to subscribe and click the bell icon so you won't miss any more insights into health, wellness, and understanding the natural rhythms of your body. See you next time.